Hello, everyone, and a very warm welcome to the medical legal series hosted by FMC. My name is Dr. Shaam Shamsi. I've been given the privilege from the editorial team and the digital director to present a series of modules around the medical legal aspects of the profession. Just a little bit about myself. I'm a general dental practitioner based in Staffordshire. I work, apart from clinically, with many organizations, as you can see, the General Dental Council, adjudicating matters of professional misconduct. So I sit on the fitness to practice, and I also assist colleagues and mentor colleagues who are facing fitness to practice allegations. I also work for Dental Protection as one of their advisory board members and as one of their risk management workshop presenters. As a training program director for foundation training, a very privileged role I've been involved with for almost 20 years now, and the Care Quality Commission as a specialist advisor to the team, inspecting practices with colleagues to ensure that they meet the quality assurance standards. I also work for the Royal College of Surgeons at Edinburgh, assisting them in examining for the MFD examination. So, in a nutshell, this is my practice based in Staffordshire. I am heavily involved with teaching and education, and along with a colleague we set up the first ever dental risk mitigation course for basically colleagues practicing high risk dentistry, but it's also applicable for people working in busy practices, general routine dentistry. So this medical legal series, ladies and gentlemen, will consist of 7 modules. Module number 1 will look at the GDC's process. So the registrant that has a fitness to practice allegation brought against them, and the preparation and how to embark upon that journey in preparation for their case, their remediation process, as well as understanding how the GDC implements its process. Module 2 will look at minimizing risk with communication and consent and shared decision making. I'm sure you'll all agree communication is at the forefront of all the work that we do with our patients, and poor communication can certainly lead to poor patient outcomes. So this module will look at how we can assess our own communication, how we can improve our communication, and more importantly, understand the importance and application of consent and a collaborative decision-making process using shared decision-making. Module 3, we're looking at record keeping. So it's titled Avoiding the Pitfalls of Record Keeping, a very important and integral part of our work, as you're all aware. And it is time consuming, it can be tedious, but it is the essential part of the documentation that should be an accurate reflection of our discussion, our investigations, our treatment options, and the treatment itself. Module 4 will also look at understanding ethics in dentistry, a very, again, important aspect of our role. Ethical standards, how it applies to us, what role do we play during clinical and non-clinical sessions, and what the General Dental Council expects from us as healthcare professionals. Module 5 will look at mastering complaints and adverse outcomes. Unfortunately, complaints are inevitable, they do happen. We need to take every measure possible to minimize complaints. But when complaints do arise, what is it that you and I can do to minimize the complaints from escalating? What is it that we can do to ensure that we can resolve the situation in-house? And the module will go one step further to look at adverse outcomes. A patient has experienced a negative outcome, an unintended harm, and as a result, what is it that you and I can do to prevent this from going further, especially to the regulatory body? Module 6 will look at raising medical legal awareness in implant dentistry. This is a high-risk dentistry. Those of us that are involved with implants understand the expectations that come with it in meeting patients' outcomes, but more importantly, being made aware of the medical legal implications in terms of preparation, in terms of discussion, in terms of consent and record keeping. And Module 7, the final module, ladies and gentlemen, will look at vicarious liability and non-delegable duty. Many of us have heard of these cases over the past few years, especially practice owners who are concerned about the work left by outgoing associates and the complaints that arise, and then the dreaded letter that comes from especially the dental law partnership making an allegation that you as the practice owner, the practice principal, are liable for the actions of the associates working in your practice. So this module will not only look at these definitions, but more importantly look at key areas, key elements that practice owners and associates alike can do to ensure that this risk is minimized. So do join us on this series. This is hosted by FMC and is brought to you so that every practice member can benefit. It's also designed to raise awareness and equip you with the tools and the expertise to minimize your risk in our profession. As we'll agree, I'm sure, that risk, ladies and gentlemen, is inherent in everything that we do. And with litigation increasing over the years, there is a need for every member of the dental team to become more risk averse. At the end of the day, it's all about risk mitigation. So do join us along this journey of the medical series hosted by FMC once again. I welcome you aboard. Thank you very much for joining, and I hope that you will enjoy the benefits of this series. Thank you.